And we are delighted to be joined today by Governor Mills, as well as Commissioner Jeanne Lambrew, the Commissioner of Maine's Department of Health and Human Services. I'm going to provide a quick epidemiological update on where things stand with respect to COVID-19, and then turn things over to Governor Mills and then to Commissioner Lambrew. So as of right now, this morning, there are currently 3,566 cases of COVID-19 across the state of Maine. That represents an increase of 8 cases since yesterday. Of those cases, 3,168 have been confirmed and 398 remain probable cases. Right now in the state, there are currently 17 individuals in the hospital. That's a decrease of 1 since yesterday. Of those 17, 7 are in the ICU and 3 are on ventilators. That's 1 fewer ICU hospitalization than yesterday. Turning to the number of individuals who have passed away, there are still 114 individuals across the state who have passed away with COVID-19, and 3,062 have now recovered. That's an increase of 54 recoveries just since yesterday. Among our cases, 842 are healthcare workers. I'd like to provide a quick update on one new outbreak as well as some other outbreaks that Maine CDC has been involved with recently. The one new outbreak is one that's been occurring at the Cumberland County Jail, where there are 3 cases of COVID-19 among clients of the jail. The jail staff have conducted an entire round of universal testing among all of the clients there. They are now in the process of conducting universal testing among all of the staff members as well. Those results should be available very soon. And as we conduct our investigation and we receive results of the rounds of universal testing at the Cumberland County Jail, we'll make sure we let everyone know and keep everyone updated. Also, a quick update on 2 other outbreaks in which Maine CDC has been involved. At Orono Commons, a healthcare facility, there remain 8 cases of COVID-19. That facility is conducting yet another round of universal testing among all residents and all staff. Again, the results from that round should be available soon, and we'll keep everyone updated. And finally, at the Pratt & Whitney facility, there remain 5 cases associated with that site. I'd like to provide next some updates around the number of individuals from other states who have tested positive for COVID-19 here in Maine. As of this morning, there have been 111 cases where, upon investigation, Maine CDC epidemiologists determined that the individual's primary residence was in another state. Now, I want to be clear, this is not the same as, say, counting a ballot. It's not a direct one-for-one. Many of these cases, for example, were among individuals who, say, live in New Hampshire and happen to get their health care in Maine. What's also very important to remember about our data overall is, for example, the number of current hospitalizations that we report, which right now stands at 17, do not make any distinctions based on where an individual lives or what their primary state of residence is. So when we report that information on our website and at these meetings, that reflects what hospitals are telling us about the number of COVID positive patients, irrespective of what the state of residence is. I'd like to turn next for a quick update on where things stand with our testing activity. First, I'd like to talk about the positivity rates. Let's talk first about the daily positivity rate for tests that were reported yesterday. Based on 1,513 PCR tests that were reported yesterday, the one-day point positivity rate was 1.65%. Now, the number that we really look at is not the one-day number, but rather the 7-day average of what's been going on. That gives us a better glimpse as to where things stand with the outbreak statewide. And for that number, the 7-day moving average of PCR positivity rates, that number now stands at 1.0%. We also are keeping track of the overall volume of tests that are being conducted. And right now, the volume of tests being conducted in the state is at 155 tests per 100,000 people in Maine. I'd like to put that number in a little bit of perspective. If you take a look at exactly 1 month ago to June 14th and run the exact same calculation, there has been a 53% increase in the volume of tests that have been done just over the past month, if you go based on that number of tests per 100,000 individuals. About a month ago, there were about 100 or so tests per 100,000, and as of today, we're at 155 per 100,000. The last thing I'd like to do is just provide a really quick update on the fit testing activity that the National Guard has been undertaking. By the time we close business today, there will have been over 3,100 healthcare workers across the state who will have been fit tested, which will then allow them to take advantage of an N95 mask. I again would like to take a moment to thank our colleagues at the National Guard for all of their efforts over the past several months to get as many healthcare workers across the state fit tested. So that's where things stand from an epidemiology point with respect to COVID-19. Governor Mills, I'd like to turn things over to you.
Thank you, Dr. Shah, as always, for your common sense report about what's going on in the public health arena during these very important times when we all need to pay attention, not just to the data, but to our neighbors and friends and community members, and make sure that everybody's staying safe. I'll turn this over to Health and Human Services Commissioner Jeanne Lambrew in a moment to provide some more information about our efforts to stand up swab and send testing sites around the state, because that's awfully important as well. First, I just want to offer a couple words. As we heard from Dr. Shah, Maine reports only 8 new COVID-19 cases today, 8 additional cases, no additional deaths. Maine is also one of only 2 states that are now reporting a decline in cases. That's welcoming news. That's welcome news. It's encouraging news. I'm very excited about this data, but I want to be clear, it's not cause for celebration. We're not going to sit on our laurels. As much as we'd like to think that things are over, we know they're not over. This is a virus that stays and stays and stays. We have no reason to believe that it's gone as much as we're doing. But as we look at other states like Arizona this week and California, Texas and Florida, cases in those states are surging in record numbers. And as we see hospitals reaching capacity there, PPE running low and testing supplies running out, governors in those states ordering businesses closed again. We got to remind ourselves that Maine is not immune. We're not out of danger. We've got to remind ourselves every day that this deadly virus is still here. It's lurking in our communities across the state. And when it takes hold, things can turn around in a jiffy, in a heartbeat. And when it takes hold, it can spread dangerously fast, and maybe little we can do to prevent the broad spread of the virus. So Maine people have done an extraordinary job stemming the tide of this virus, but we can't let up right now. We have to continue to stay 6 feet apart, continue to wear face masks, face coverings, continue to wash our hands often and practice good hygiene. We do all these things, as you know, to protect ourselves, to protect the health and safety of our loved ones and that of the members of our community, to give our businesses, many of whom are struggling and on the brink of failure, a shot at survival, and to be able to open our schools in the fall, hopefully. We've got to continue making these efforts and taking these measures to keep people safe. The best thing we can do for our health and for our economy is to stay vigilant. The worst thing we can do is to let our guard down. In fact, it got me thinking about a letter I got last month from Gracie, a 3rd grader in Portland, also sent me a great picture of a tree. Must have been apple blossom time or something. She wrote, quote, "I know your job is really hard, Governor. We will all help you along the way." I hope everybody follows Gracie's lead, continuing to help each other all along the way. And it's a long road. It's a marathon, not a sprint, as we say. That's how we'll get through this together. And one last thing Gracie also wrote in her letter. Some kids are really sad, she said. Can you please tell me when we can have play dates again? Well, Gracie, having raised 5 girls myself, I want you to listen to your parents first and foremost, but I want you to know that your governor cares about you and loves you and wants you to be able to play with your friends again safely. And to any kids out there right now who are feeling sad, neglected, or not able to see or talk with their friends as much as they want, I want you to know that we all care about you. I care about you. I love you, and things will get better. So let's stay strong, hold tough, be kind to one another for our own kids, our neighbors' kids, for our communities, our businesses, our visitors, and ourselves. Thank you. Commissioner Lambrew, do you have any comments or updates for us on swab and sand and testing sites?
I do. Thank you, Governor. We are proud to announce today that 7 healthcare organizations will collectively launch nearly 20 COVID-19 test collection sites that will send samples to the Maine State Lab for testing. These so-called swab and send sites will strengthen access to safe and accessible testing for Maine residents and visitors alike. Specifically, the department is finalizing agreements with Northern Light Health, Penobscot Community Health Care, Maine General Medical Center, Mount Desert Island Hospital, Calais Regional Hospital, Northern Maine Medical Center, and Promerica Health. The swab and send sites are or will be available in Bangor, Brewer, Old Town, Augusta, Portland, South Portland, Belfast, Ellsworth, Blue Hill, Dover Foxcroft, Presque Isle, Calais, Greenville, Waterville, Pittsfield, Bar Harbor, Fort Kent, and some of these locations will have multiple sites. Additionally, we will have mobile sites that will also launch within the next 2 weeks. The department continues to work with other organizations to stand up additional swab and send sites to improve access throughout Maine. Some of these sites are already in operation, while others will come online in the next 2 weeks. These 18 drive-through, drive-up, and mobile sites will offer specimen collection free of charge to any individual who believes they may have COVID-19 or could have been exposed to the virus, with or without symptoms. This includes healthcare and hospitality workers, people of color given known racial disparities in COVID-19, and visitors from other states with a higher prevalence of COVID-19 than in Maine, among other categories. As part of the administration's vast expansion of testing capacity announced last month, the department invited any organization to establish these specimen collection sites to send to the state's Health and Environmental Testing Laboratory, or HEATL. A federal grant will fund these sites through at least August 31st, and after that, we expect these sites to be able to bill insurance to continue their operation. Creating Maine-based testing capacity is especially important as national laboratories struggle to handle other states' surge of COVID-19 cases. This capacity prevents the Maine lab from experiencing the shortages of testing supplies and reagents that occurred early in the pandemic. We thank these healthcare organizations, including IDEXX, for partnering with us to continue to protect the health of Maine people and visitors. These 18 sites complement roughly 40 current sites that are already available to the public. For a complete and frequent updated list of all COVID-19 testing sites in Maine, visit get-tested-covid19.org. And with that, I'll turn it back over to Dr. Shah for questions.
Great. Thank you, Governor. Thank you, Commissioner. We have got a full slate of questions, 13 of our colleagues from the media today, so we'll go ahead and dive in. And the first question today goes to David Horowitz from ABC7.
Yes. So my first question is, what is Maine doing to keep people from highly infected states out of the state?
Sure. Governor, do you want to kick us off?
We have executive orders relating to travel that basically require anybody coming to this state from most states other than certain New England states and New York and New Jersey, requires them to either quarantine for 14 days or get a test within 72 hours of coming here. And that is happening, I can tell you, because I've heard from people who got tested and tested positive, so they're not coming. So it's working. Now, that's the basic rule. And I think it's becoming widely known that that's the basic rule. People are on the lookout to be protective of themselves and other visitors and businesses as we engage in summer tourist season. Does that answer your question?
Yes. I just have one more question. So there's a lot of differing opinions regarding masks, like personal opinions, but what do we know, like scientifically, masks can do to help prevent the spreading?
Sure thing, David. The masks can work, or face coverings can help reduce transmission of COVID-19 in two ways. The first and the most well-studied is they can prevent you, if you have COVID-19, from propelling the droplets that have the virus in them and spreading them across a room and spreading them to other people. So that is to say, your mask that you wear can protect other people from getting COVID-19 if you got it. There's also some very preliminary emerging data that also suggests that the mask can protect you from inhaling those same droplets. Those data are not all yet in yet, but what we definitely know is that the mask prevents someone from projecting the bacteria out, the virus out, so-called source control. And the studies around that have been around and they've been well validated. And so we know the science is sound in this respect. I'm going to turn next to Patty White over at Maine Public.
Thanks very much. Dr. Shah, I apologize if you already said this, but what's the time frame for when the 111 cases that were confirmed in visitors from out of state, when were those cases confirmed, and do we know what proportion of confirmed cases in recent weeks are in out-of-state visitors versus Mainers?
Sure. So that 111, Patty, is since we began our activation since day one, going all the way back to March. What's changed in the recent weeks? The last time we drew the numbers, it was in the high 80s. Now it's 111, so it has gone up. But whether those individuals who have been recently diagnosed are still within the state, or rather they are New Hampshire residents who have just come and got their health care in Maine, we'll run that and get you that number.
Okay, great, thanks. And then I had a question related to the swab and send sites. I'm wondering how many, what's the current number of contact tracers that we have, and is it enough to meet demand with the expanded testing that's going to come with these swab and send sites?
Sure. So I'll start there, and Commissioner, we overall, in terms of individuals who are doing case investigation as well as contact tracing, we just took a look at the latest tally, and there are approximately 75 or so who are doing combined case investigation as well as contact tracing. We're still in the process of hiring additional individuals. So again, Patty, I'll get you the latest numbers on that. We took a look at it on Friday, and we've even since then trained additional case investigators. So just Monday and Tuesday of this week. So we will check and get you the exact latest number as of right now.
Thanks. Can you just say, how quickly are they able to follow up when someone tests positive? I mean, what's the capacity like now, and is it enough to when there's increased testing?
Sure. So based on where things stand right now, every single individual who tests positive is able to be contact traced by the Maine CDC team as we currently have it. Of course, we anticipate finding additional positives because we're so dramatically scaling up the amount of testing. So right now, where things stand, all of the cases that are positive in Maine are contact traced by Maine CDC, but we're continuing to add to the number of case investigators and contact tracers as we move forward, because we know we're going to have more cases.
Thank you.
You bet. I am going to turn to Steve Betts at the Courier-Gazette. Steve? We'll come back to Steve in a moment while we turn to Rose Lundy from Pine Tree Watch.
Hey, thank you for the opportunity to ask a question today. So we've been in this pandemic for months now, and many of us, I'm sure, like myself, have been following the constant updates of numbers of cases and deaths and hospitalization rates and test positivity rates. And there's just so many numbers out there right now. So for people who are starting to feel numb to all of those numbers, how do you keep them engaged with your efforts? And what are the most important metrics that we need to keep in mind when we think about the current state of the pandemic and then as we move forward?
Well, let me begin, if I may, by saying, just watch the evening news. It is easy to become numb to statistics. We see that in a number of areas, but these are so volatile. And watch the evening news, read the newspaper, go online and see what's going on in Oklahoma, Texas, Florida, California. In California, I think I read last night, they shut down, they're not opening schools at all. And in several states, and I'm on the White House call on Mondays with Governor Greg Abbott and Governor DeSantis and others from those states who are bemoaning the fact that they didn't close bars early, didn't close them at all. Now they having to go back and close indoor dining, indoor activities of all sorts, because their positivity rates are sky high, well over 20. Compared to ours, I mean, we are very fortunate and people have been cooperative. So to avoid becoming numb, I guess, hear what our neighbors are doing, hear what people in the southwest of the United States are doing, hear what people in Florida are observing and feeling, and how many people are getting sick and hospitalized in those states, and it's pretty devastating. So I'll ask Nirah and Jeanne to also chime in.
Rose, you mentioned some of the metrics that are the most important right now. Of course, it's not just any single metric, it's the constellation of metrics that tells the full story. So it's not any single one. That being said, what I'll tell you is that the metrics that I look at first and foremost every morning are the positivity rate over the last 7 days, the number of new cases, not just in Maine, but elsewhere, as well as the volume of tests per 100,000. Same numbers that I report out. Those are the same numbers that I take a look at with my team every single morning. And we look at them not just in Maine, but for our neighboring states as well as nationwide, because we're always trying to get a sense of what might be going on elsewhere that could end up here. As the governor said, we only need look at what's happening in other parts of the country to understand that that very same thing could happen here. Commissioner?
I'll just add that in addition to numbers, it's the stories. It's the person with a parent or grandparent whose parent or grandparent got ill because of contact with them. We have children who are also not immune from this. We've seen stories of young adults who have gotten sick and been seriously hurt by it. So I do think that we have to take this pandemic as the very serious illness it is and continue to do what's been working well for Maine. As the governor has said, now is the time to be extra careful because we can protect and prevent these large spread outbreaks if we act now.
Thanks, Rose. Let me turn back to Steve Betts to see if Steve's back with us. All right, Bob Evans at News Center.
Good afternoon. My first question is for Commissioner Lambrew. Behavioral health providers who contract with the state have said their ability to continue services for people with mental illness and substance abuse is at risk because they haven't seen enough of the federal COVID aid received by the state. How will the state be able to provide these services if any of these organizations cut back or shut down altogether? And will the state be providing them with any additional CARES Act funding?
From the start, we talked about the importance of maintaining access to important healthcare, including behavioral healthcare, throughout the pandemic. That's why very early on, we provided support for telehealth so that people could continue to engage with their providers safely. We have continued to support phone lines, hotlines, a frontline warn line to make sure that people can access help remotely. And as we've been going back into engagement, because back in May, we began at stage 1 of our reopening to reopen healthcare, we've also begun to look hard at our data to see how else we can help. So, for example, in some areas of behavioral health, we saw significant drop-offs in terms of utilization. So beginning on July 1, for certain types of behavioral health, we've been providing per member per month support for those behavioral health organizations to reconnect, to use it to do the kind of bridge work to make sure that those people who they've lost touch with, for whom telehealth didn't work, like children, to make sure that they have the support that they need to re-engage with people. So we continue to monitor data, continue to look at best practices, because we care passionately about making sure, especially at this time of stress, people who need behavioral health get it.
Do you see the state providing them with any additional CARES Act funding?
We are always looking and evaluating needs and opportunities, but I will say that as we also look at what's going on in our health system, we are trying to protect and preserve what we have. We're quite worried about maintaining benefits and maintaining coverage in light of the economic impact of COVID-19. So we are absolutely monitoring and looking, but we also, as the governor can speak to, are carefully looking at our ways we spend that CARES Act funding to make sure we don't someday down the road have to cut.
Understood. Dr. Shah, I have a question for you, unless the governor did want to add anything.
No, other than, we're putting together an update of our correspondence with members of Congress, our members of Congress, about the statewide needs, judging from the recession that we're in and the dearth of services in some areas, and not just what state and local governments need, but what businesses and nonprofits need as well.
Thank you. Dr. Shah, News Center Maine did a story last night about small Maine healthcare providers who say they have been struggling to find personal protective equipment. Can the CDC assure long-term care facilities, doctors' offices, and others who need them that they will have enough PPEs, masks going forward?
Sure, I can start that, and Commissioner Lambrew wants to weigh in by all means. So we've been in close contact with small independent physicians to hear their concerns. We understand that they need PPE in order to be able to do the work of seeing patients and keeping all of us healthy. Thus far, in our response to COVID-19, we have moved PPE out to a couple of different types of providers: long-term care facilities, local fire, rescue, and EMS providers, as well as hospital groups. In many instances, physicians are attached to those hospital groups. But we've simultaneously heard that smaller independent physician offices need to have access to PPE. So we've had a meeting with them not long ago to understand what the nature of their needs were, what the volume might be, and now we're working to figure out collaboratively how we can move toward that. We certainly hear them, and we're now trying to figure out where to go in terms of furnishing them PPE. Commissioner?
This is a national problem, not just a Maine problem. We've seen shortages from the start in different types of PPE, and we remain extra vigilant about this. And our priorities here at the state are, number one, to make sure that emergency stockpile does have sufficient PPE in the event of a surge, because our job here is to make sure that if indeed what's happening in almost 40 states nationwide comes to Maine in terms of an uptick, we're ready for that. Number two is regularly procuring PPE to make sure our systems, our supports are there for the long run. And third is growing our own. In the same way that we have been working with IDEX to expand our lab capacity, we're working with manufacturers in the state of Maine through our Department of Economic and Community Development to figure out, can we make face coverings in Maine, gowns in Maine, even maybe N95s in Maine. So we are simultaneously trying to make sure that we're prepared for an emergency. We help providers as needed on this ongoing basis, but we also prepare in case we're in that kind of shortage that we were several months ago, to have some locally produced PPE for Maine.
I'll just add that there are two other things going on. The federal government is shipping PPE direct, hundreds of thousands of various forms of PPE directly to nursing homes across the country. And I have a complete list of the shipments that have been made to Maine nursing homes. Plus, the Department of Corrections for the last nearly 4 months has been manufacturing and making PPE to the tune of nearly 100,000 pieces of PPE that they've been providing to farm workers to some educators to school departments to Maine Housing Authority, Office of Child and Family Services for Children in Custody, and the county jails and Dorothea Dix and places all around the state. So working at all angles.
Thank you all.
Thanks, Bob. I'm going to turn to Emily Tadlock next.
Hi, Dr. Shah. I actually have a question. I think most of my questions are going to be directed towards Commissioner Lambrew. My first question is about the swab and send sites. Are some of these sites already up and running?
Yeah, some of them are. Many times we're working with organizations that have the capacity to do it anyway. So what we're doing is we're broadening access to those sites. So those sites will be able to send to the state lab rather than the lab that existing organization's already using. But it is a work in progress. We put in our press release the ones that are open today. We expect a number more to come online next week. And we continue to have our doors open to additional organizations that may be willing to make sure that people throughout the state of Maine have that access.
Okay, and then my other question is, can you provide some clarity on who can get a test? I know, especially for people who are just watching this at home, who might just want to say, hey, this place is open at Calais Regional Hospital now, let me drive over and get a test. Will anybody just be able to drive up and get a test?
Sure. So the department issued what's called a standing order, which means that for people who have symptoms of COVID-19 or had a close contact with somebody who has COVID-19 or who were at elevated risk of being exposed to such people, they may work at a hotel with lots of tourists or in a grocery store where there's lots of people coming in. Or as I mentioned earlier, we know that people of color in Maine have a really high rate of COVID-19. They're at elevated risk. So people at elevated risk can qualify to get a test under our standing order. Additionally, as time goes on and we try to do what's called sentinel testing, that testing to make sure that we're not missing pockets of COVID-19 in the underlying population, that's a group that like nursing facility staff, for example, or different types of staff, we're going to be cycling through those different levels. But we are trying to say, if you're just curious, if you just want to know if you have COVID-19, that's not a good use of a test. So we do try to recommend that people who have symptoms, a close contact, or elevated risk of COVID-19 can get a test at these swab and send sites, as well as other sites that are listed on that website I mentioned that accept the standing order.
What about visitors to the state visiting these swab and send sites?
Yes, our standing order is not restricted to Maine residents. It is for visitors who are coming from states with higher prevalence, which these days is most states in the nation.
Great, thank you.
Thanks, Emily. I'm going to turn to Eric Russell at the Press Herald next.
Good afternoon. Thank you for taking the call. I have two testing related questions. The first is, and it was just alluded to in the last question and Commissioner Lambert's answer. If I'm somebody who works for a public facing business or a first responder or healthcare, whatever the case may be, how often should I be taking a test? Particularly if, you're asymptomatic you could be contagious when you're asymptomatic. How often do you recommend people who are coming into contact with a lot of people, how often should they be tested?
So Eric, this is a really good question. And the straight answer is that there's not yet nationwide uniform guidance on this. So what we recommend that individuals who fall in that category do, whether they work for a local fire and EMS or a long-term care facility, is to check with their healthcare entity, the occupational medicine group that helps that organization out. That organization will have the best data in terms of how often someone should be tested. Some data suggest every week. Other data suggest that if you're in a county where the background rate of disease is lower, it could be every couple of weeks. Even some folks are even saying up to every month. So it really does vary. There is not a uniform answer. It depends on what the nature of the contact you have with individuals outside of your job are, as well as the background rate of COVID-19 in the area in which you're living. So unfortunately, there's not a uniform answer. What we can say is that the swab and send sites that Commissioner Lambrew outlined are able to accommodate this type of use, though. So there is the availability of that testing, but in terms of the frequency with which it should be done, that's really more of a decision on an organization by organization basis.
Okay. And the second question I have has to do with timeliness of results. We're hearing stories in other states and a couple here in Maine as well about a delay, maybe 5-7 days or more. And I mean, as you guys well know, that's extremely problematic. Are you seeing some of these delays in Maine? And if so, why is it happening and what are you doing about it?
So I'll start and then again turn it over to the commissioner. What's happening, Eric, is that many of the delays. So I want to spotlight a couple of things in your question. You were correct to note that many of those delays are predominantly happening outside of Maine. The Maine CDC Health and Environmental Testing Laboratory up here in Augusta is still able to turn tests around within 24 to 48 hours. We have not had a backlog and we're still able to get tests in, run them, and result the results out very quickly. What has happened, however, is that owing to the significant spike of COVID-19 cases pretty much everywhere else, the national laboratories that do a high volume of tests, these are the Quests and the LabCorps of the world, they have been overwhelmed and inundated with tests. And as a result, they have informed states that their turnaround time would be slipping from the 4 to 5 days that it was previously to the 7+ days, which it is in some instances now. That's really what's causing a lot of the delays right now. It's a good reminder, I think, that what can happen in another part of the country can have direct impacts on people in Maine getting their test results here. So we've heard the same reports as well that individuals in Maine who say their doctor's office may use Quest or LabCorp, they may have had experienced a delay in getting their own results back here in Maine because of the surge in volume that these national laboratories are facing.
And I will just add that that's why we feel some urgency to get these swab and send sites up and going, because unlike some other sites, when you go to one of the sites that we're setting up, they stay in Maine. They go from the site in Maine to the Maine State Lab and back to the individual. They don't leave the state, which gives us that greater degree of control. And while our state lab is pretty quick, as Dr. Shah said, we're also going to try to shrink down that time between the site collecting the sample, it getting to the lab, it going back to the site, and you getting your results. So we're going to be trying to do our best to, within, again, the state of Maine, collect and test and return those results in a timely way, which is why we're excited for the new partnerships that we announced today.
Thank you.
Thanks, Eric. Going to go to Amy Brown next.
Thank you, Dr. Shah. Is Massachusetts, I don't know, I think this is probably a question for Governor Mills. Massachusetts positivity rate, 7-day positivity rate, looks like it's 2.5% according to the Johns Hopkins Resource Center website that tracks that stuff state by state. Are they getting close to being allowed to come into the state without the quarantine period or the negative test?
Well, we would love to open up the state more widely to Massachusetts visitors, although if you drive up Route 1 or almost any road in the state of Maine, any public highway, you'll see Massachusetts plates. They're coming here. And I'm confident that most of them are abiding by the rules. We continue to look at those statistics every day. I had a nice conversation with Governor Baker a week and a half ago. We talked about the data. We agreed to keep talking about the data and have our public health people continue to analyze the data. But just the other day, you saw that 8 towns and cities in Massachusetts were considered such high risk. They were pouring a lot of extra money into testing sites and whatnot in those states, you know, that in those cities. And you know that Boston has barely opened up. Boston, which was really one of the epicenters of the COVID-19 virus not too long ago. So we're kind of cautious about it. We want to welcome them here. We want them to come here, spend money here, enjoy our natural beauty and be here as they have been in many decades in the past. But we don't want them to bring the virus. And I did ask Governor Baker about testing in his state, because I said, look, some of the hotel owners are complaining that people want to book a room here from Massachusetts. They're being told to test. They say they can't get tested. He told me there's no reason somebody can't get tested in Massachusetts. The Commonwealth has a number of test sites all across the state. They are paid for by insurance or by public funds if you are exposed or person at risk. And if you want a test to go on vacation or whatnot, you might have to pay for it yourself. maybe $100 out of pocket, but the tests are available. That's the main point. So I want to make sure we get the word out. People are welcome here. We just want them to get tested first.
Great, thank you. And my second question is, where is the state in terms of planning for returning to school? And what's the current thinking about that?
Oh, we could spend an hour on that easily right now, and we'll spend time on that in the coming days and weeks. Pender Macon and her department are working with superintendents and with the MEA and other union members and parents and school boards across the state. You know, we have 277 very different school districts. We have about 600 public schools, buildings, facilities, and 27 CTEs. They're all very different facilities and with very different needs. I know my district, SAD 9, has the highest transportation costs of any district in the state. Other districts don't have the transportation costs that they're going to have to, where they're going to have to change a lot of the transportation modes. But other districts have other challenges, higher needs for higher numbers of special ed, for instance. But the main thing is public health will guide our decision-making and our recommendations with regard to how and when schools open for in-classroom instruction. Clearly, we want kids to stay involved and not to lose in their achievement levels. My biggest concern is what I hope is not happening, but what I fear may be happening is the growing disparity between the haves and have-nots, among our school children. Those who've been able to stay involved, who've been able to stay connected with their teachers and their schools through the internet for the last 4 months, and those who have not been able to do so. We've tried to address that latter group of kids by buying, with assistance from philanthropists, from federal money, buying hotspots and other gizmos to keep them connected. But I really have some serious concerns about the disparity and the achievement gaps that we may be encountering. So I want to get kids back into school for in-classroom instruction. It's a matter of how and when we do that while protecting the health and safety of teachers, faculty, and students and visitors to the schools.
Thank you.
We're going to go to Charlie from the BDN next.
Hey, Dr. Shah, sorry for the delay there. Thank you. Can you hear me?
Yeah, go ahead, Charlie.
Okay. So my first question is about the Cumberland County jail outbreak. Is, I guess, kind of two questions tied to that. One is whether that includes the case that was announced a few weeks ago. There was an inmate who was announced to have the virus. And then just, can you give any more information on the breakdown of inmates versus staff who are in that 3 people you mentioned? And do you have any information about what may have caused the outbreak?
Sure thing, Charlie. As to your former question, that number 3 does include the one case that was reported some time ago. And right now, all of the 3 cases that we are reporting are among inmates, not yet staff. The staff testing is underway or will be soon underway. And once we have the results on that, we'll make sure we report out on it.
Okay.
And then, in terms of the potential avenues from which it came in, that is, of course, that's the focus of the investigation. And given that it's a jail, there's a high number of both inmates as well as staff who are coming through on a day-to-day basis. But that is the focus of the investigation. We're just getting that underway right now. So we're still gathering data to try to get a sense of how it may have been introduced.
Okay. And then 2 smaller questions related to the swab and send site expansion that you mentioned. So the number 18 new sites, are those all truly sites that have not been operating before, or is it a smaller number that are truly just getting off the ground? And then relatedly, can you foresee the state adjusting its standing order to expand more conditions or types of people in the near future with this expansion happening?
Sure. I'll take the first shot and then Dr. Shah jump in behind me. So all of the organizations that we're working with exist. They're not new organizations coming to the state of Maine or being developed for the purpose of testing. What we're doing, though, is trying to open up their testing to a broader range of people and sending their samples to our state lab. That's the difference. So currently, many of these organizations use different laboratories for their testing, and we are trying to, number one, say for the purpose of this swab and send those samples to our state lab. And number two, we are trying to make sure that we have these locations throughout the state so that we can make sure that the vast majority of people in Maine have access to one of these sites in their community. So we won't have a ton of them in the same place. If there's one in a site, that's probably sufficient, depending on the size of the town. But our hope is to geographically spread them so people throughout the state can have access. And to your second question about broadening testing, we're absolutely willing to consider that. Right now, we want to continue with our tiers, or I should say our standing order categories. One being people who are symptomatic or close contact. Two being people with elevated risk with or without symptoms. And then third, as we get into the sentinel testing, that may have other implications in the fall as businesses are reopening, as the governor talked about schools are reopening. We're going to revisit that once these sites are up, operational, and we can see what the fall looks like.
I'll add on top of that, Charlie, that the standing order and who it encompasses and provides testing for is right now incredibly broad. As Commissioner Lambrew just noted, it encompasses individuals who have symptoms, who have been exposed to somebody, who may have been exposed to somebody, folks who are just at higher risk because of the nature of where they live, where they work, or where they may come from. So even at baseline, even before contemplating any further expansions, it already casts a very wide swath and covers a lot of folks. So we're certainly open to it, as the commissioner noted, but I think it's just important to note that at baseline, it already casts a very expansive net.
Thank you.
Thank you. We're going to turn to Maria Sacchetti at the Post next.
Hi, everyone, and thank you very much for having these press conferences. I wanted to make sure I checked the number of contact tracers you have in Maine. Is it 75 people? Is that correct?
Maria, I'm going to check and see. The last time we updated the numbers, or that I was briefed on the numbers, was on Friday. But even since then, we have trained additional case investigators. So we're going to check for the latest number to reflect the trainings that occurred yesterday and today. And we'll get back to you and Patty on that.
Okay. I also wanted to ask, in addition to that total number, how many of those are people of color, and how many speak other languages such as Somali or Spanish? So that just curious about that breakdown, please.
Sure. We'll make sure we furnish that as well. Your question raises an important point. As we have been going through the process of hiring contact tracers and case investigators, we know that that's a job that involves and entails not just being able to speak someone's same language, but interacting with them in a culturally appropriate and sensitive way. So we've deliberately tried to make sure we hire individuals who reflect the cultures of who we have here in Maine. And so we'll make sure we get you those figures as well. But please know, and I just want everyone to know that as we've been building our force of contact tracers and case investigators, we've done so with a deliberate nod to making sure we are speaking the same language as people who have COVID-19 out there do.
And I'll add just 2 points. One is we're trying to complement that CDC staff with people from ethically led or run community-based organizations who are on the ground helping us do this work. So it won't just be Maine CDC staff, it will be people from these different communities who are affected by COVID-19, in recognition of the fact that those folks often know what's best, how best to educate, support people with COVID-19, and help prevent the disease in the first place. Additionally, this is part of our broader effort at the department to really diversify our workforce. We recognize the fact that we really need to be broadening our ability to address the underlying racial disparities in the state of Maine. So this is part of our plan.
I'm going to turn next to Jay Mishkin from WGME.
Thank you, Dr. Shah, for taking my question. We're hoping you can clear up something about the numbers. And it's been an ongoing thing for us. You reported 8 new cases today, and that's the same that we all reported this morning. Most of the meetings, we all reported 8. But if you take a deeper dive into the website and you look at the trends tab, you'll see that the increase indicates 12. And the number that was reported yesterday morning is different than today. And I know the website changes and updates numbers, and this has happened, but we want to be accurate when we report numbers. So what really is when we look at the numbers in the morning, what should we be saying is the most accurate number? Is it 8, like you mentioned? Is it 12, like we're seeing on the site? Or where should we be? What's the most accurate number there?
Sure. So what's going on here, Jay, is, and this is right at the very top of the website. Several weeks ago, we announced that we were going to be changing the way that we reported and portrayed numbers on our website. Previously, what we reported every morning was that which was reported to the state. But that's not really epidemiologically accurate. When something gets reported to Maine CDC, doesn't really tell you when it actually happened. So what we've decided to do, and what other states are doing at the recommendation of the US CDC, is changing the way that we furnish data on our website to move away from when it gets reported to the state to when the event actually happened. In the case of in the situation of new cases, that's either when the diagnosis was made or when the individual first started showing symptoms. So that accounts for the difference that you're seeing. Now, in terms of which one to report, what often happens is that as our case investigation proceeds, we learn more and different things about all the cases. And that's what accounts for the daily difference. So the number that I look at is the number that I report every day, which is today 8, because that is what's changed in the past 24 hours. We may later, a couple of days from now, find out that one of the cases that got reported to Maine CDC actually got diagnosed and reported in their lab tests, not yesterday, but 2 days ago. And then we'll adjust the numbers accordingly because our website is trying to portray the most accurate epidemiological picture. But in terms of what's changed in the past 24 hours, that's the number that I look at every morning when I brief with my staff. And for today, that number is 8.
Okay, one quick follow-up. I know we talked about Massachusetts, and I will say then to a lesser extent Rhode Island, but are we tracking any other states in the country that could one day or at some time have their quarantines lifted for visitors?
Really, all of them.
Yeah.
Are close to meeting the threshold?
What's that? Oh,
Other states close to meeting the threshold to be able to allow visitors here?
today?
Not really right now, Jay. So we're tracking what's going on nationwide. We do pay a bit more focus with respect to states that we know the bulk of tourists hail from. And right now, and we evaluate the data very frequently, but as others have mentioned, looking at Massachusetts, for example, their positivity rate is in the 2s, whereas ours is in the low 1s or the 0.9 to 1% range. So, there's a ways to go.
Thank you.
I'm going to turn next to Megan at WMTW. Hey, Megan. All right, we'll turn to Patrick Whittle.
Dr. Shah, thank you for taking my question. Sorry, I didn't hear you. I'm sort of multitasking between a number of things. First question is about the swab and send sites. We've talked a little bit about private labs and outside labs about how sometimes they can get backlogged. If the swab and send sites, and we're opening up roughly 18 more drive-through, drive-up mobile sites, and all of those tests will then go to the state lab, what are we doing to make sure that the state lab then doesn't get backlogged?
I'll begin, but Dr. Shah, you should jump on in as well. As we announced previously twice, first we did a deal with IDEX to get us 5,000 more, ability to test 5,000 more people a day on top of our existing capacity. Then our second announcement was that we thought we could increase that even more significantly by having a mobile lab, by bringing in more of these high throughput machines, bringing on more staff. So we feel as though the number of tests that we would be getting with what we announced today is below what our capacity would be. So we still have room to grow. So we look hard at our numbers. We really don't want to overpromise to people, and we don't feel like we're overpromising. All that said, we continue to look hard at where are these sites, what is the demand, and how do we optimize it, because we really are committed to providing people in Maine who visit Maine who are in one of these categories with access to testing in the coming months.
Thank you. I'm going to turn for our last question of the afternoon to Patrick Whittle at the AP.
Thank you very much. Today is primary day, of course, and we've talked a little bit about the specific challenges that presents in terms of safety protocols and encouraging absentee ballots. I'm wondering if we have any idea of how it's going so far, and if there are any other challenges that have arisen because of it. And also, it would be great to know if the three of you have voted, and if so, did you vote in person or absentee, or maybe you didn't? I would love to know that.
Well, I voted absentee over a week ago. Have we heard? I've been working with Matt Dunlap. I mean, Matt and I talk frequently. He's always talking to my office. I have not heard today of any problems at the polls, but we stand ready to assist if there's any congestion or any breaking of the barriers, as it were. People are generally pretty well behaved at the polls. You know, those wardens, those registrars are pretty strict disciplinarians. But I think with paper reporting, about 200,000 absentee ballots have been requested, 60-something% of them having already been cast. We expect a flood of them to come in today before 8 o'clock tonight as well. I think things are going pretty well.
Absentee for me.
Okay. Jeanne, did you vote?
Absolutely, absentee. 2 stamps just in case.
Yeah, I put 4 stamps. Takes a while to get to Farmington.
Well, Governor Patrick, thanks for your question. Governor, that was our last question for the afternoon.
Well, thank you. And thank you, Patrick, and all of the members of the press who joined us today. Talking about Election Day, which is also Bastille Day, I just want to point out the 2 bonds that are on the ballot as well. If people have not yet voted, I urge them to support the 2 bond issues right now. Bruce Van Noot did a couple of tremendous op-eds on the transportation bond, and we've been issuing statements about the broadband bond. But really, more than ever before, these bonds are extremely important at a time when interest rates are at an all-time low. There couldn't be a better time to borrow money for governmental capital expenses for infrastructure and whatnot. The transportation bond, $105 million, which will also draw down another $257 million in matching funds for shovel-ready projects, all ready to go. We need these jobs. These are good-paying jobs at a time when Maine needs them most. And the broadband, I think everybody understands now after the last 4 months of trying to telecommute, telehealth, telelearn, everything, that Maine absolutely needs better internet capacity. This bond will help get us there. Please support it. And in the meantime, if people are thinking about what to do this weekend or in the downtime or in the afternoon, I've been taking day trips here and there across Maine, and I'm loving seeing what I'm seeing, talking to people on the streets. I encourage you to go up to the Rangeley Lakes. There's a public park there. You can camp out. You can go to some nice hotels and restaurants. Go to Greenville and Moosehead. Camp out at Lily Bay. Go to some of the lovely restaurants and hotels there. Go to Mount Blue and tumble down and climb a hill, climb a mountain. Go to Aroostook State Park along the Aroostook River. You won't find anything more beautiful than any of these parks and facilities. And Lubeck and Eastport, which I dashed off to a week ago, thoroughly enjoyed. Most beautiful places in the state of Maine, some of the most beautiful places in the world. Get out and see Maine, and don't forget to vote before 8 p.m. if you haven't already. Thank you.
Great. Thank you very much, everyone. Have a great day. Thank you, Dr. Thibodeau, as always. We'll see everyone on Thursday.